Dr. Olarenwajo said any woman treated at the center as a result of obstetric fistula is usually placed on family planning to avoid unplanned pregnancy that could lead to a reoccurrence of the condition. He noted that family planning is a powerful tool in preventing obstetric fistula and promoting women's overall health and autonomy. The head of clinicals added that these women are encouraged to return to the center to give birth, which is usually through cesarean section.
Once somebody has a fistula, the federal government gives us the right to mobilize them, so from the community. So, our mandate is about not only treatment but prevention, also research, rehabilitation, and also reintegration. So we're concerned with not only treating them, we're also concerned with getting them empowered and also getting them back into their society. And essentially, once you are treated, it becomes our burden to make sure that subsequent deliveries too, generally immediately after the surgery you cannot give birth, so for like 2 years. So we still give them family planning. But subsequently after that, they have to undergo what we call cesarean section, just like.
Dr. Ogbara said the cesarean section is free of charge, noting that with the Federal Ministry of Health and Social Welfare directives for a free emergency cesarean operations program, any woman with a history of obstetric fistula can be delivered in any federal or state government tertiary facility. Also speaking on obstetric fistula, the team leader of the surgeons who participated in the pool effort fistula surgeries at the National Obstetric Fistula Center Ningi, Dr. Saad Idris said poverty, ignorance, malnutrition, female genital mutilation, and lack of quality basic healthcare facilities are predisposing factors for vesicovaginal fistula or rectum vaginal fistula.
Lack of basic amenities, where a woman can come maybe in labor, or maybe the medical personnel are not there, or the personnel are inadequate, they could be overwhelmed. The woman that's supposed to go for cesarean section and the obstruction get relieved, they will not really get there on time. They don't come on time. You know what our people will say, no, we all deliver at home. We don't want to go to the hospital. And they stayed. Or when they come, no light, no manpower, no road networks, sometimes no bed in some situation because the hospital beds are occupied. And then they end up having this prolonged obstructed labor. And sometimes it's even the quality of the medical personnel because of care being given to them.
Dr. Yakubu Adamu noted that women who had gynecological cancer underwent radiation or chemotherapy are also exposed to obstetric fistula.
I've also seen women who have undergone hysterectomy. Surgical removal of their womb can actually come down with some of these fistulas. So these are some of the other causes. But like he said, the main direct cause is prolonged obstructed labor.
The medical doctors emphasized that most cases of obstetric fistula are preventable, but pointed out that the failures in timely access to maternal health care, especially emergency obstetric care, infrastructure, and inadequate human resources are some of the challenges. Treatment, they added, is possible through surgery and conservative treatment, and many women go on to live healthy and dignified lives after repair. Elizabeth Carr, BATV News.
According to Alhaji Ibrahim Musa Madaki, the trade, which has decades of history, is silently dying due to low patronage by its customers adding that the problem is even more pathetic in Bauchi than any other state in the country. He attributed the problem of low patronage in Bauchi to two things. One is what he described as economic factor on the part of members of the association in the state, whom he said are small income traders, saying that most of them did not have enough capital to go outside the state to buy animals to slaughter. As such, they have to limit themselves to buying animals in markets within the state, which are too expensive compared to those sold in markets in neighboring states of Jigawa, Yobe, and Adamawa states. Ibrahim Musa Madaki said another factor for the low patronage in the state was the lack of government commitment by the previous administrations, adding that in other states like Borno and Niger State, government gave to members of the association a kind of soft loans in order to boost their trade. The situation is different in Bauchi. Ibrahim Musa Madaki said he has confidence in the ability of the government of Senator Bala Muhammad that it can do more than that of the governors of those states. The chapter chairman of the association then called on the state governor, Senator Bala Abdul Qadir, to rescue the butcher's trade from dying by assisting members of the noble trade with capital, even if it will be in form of soft loan as it is done in other states, adding that over 90% of its members have voted for his government. In Bauchi, Aliu Sambo reporting for BATV News.
The team won the medals through Mohamed Isiaka, who got a silver medal in 100 plus kg. Bashir Mohammed won 2 bronze medals in the 60 kg category, while Aisha Inua Isa clinched bronze in 55 kg category. Currently, Bauchi State has 1 gold, 2 silver, and 4 bronze medals. Earlier this morning, athletes representing Ogun State blocked major streets protesting the non-payment of their campaign allowances. This development disrupted the movement of athletes and officials to event venues. Elizabeth Carr, BATV News.